Welcome to Cancer 101, an educational program specifically designed for the African American community. This is Module 3 of our program, and here we will discuss some of the risk factors related to cancer and how to reduce these risks. Because cancer is a chronic condition, we would like first to take a look at chronic conditions in general. A chronic disease or condition has three main characteristics. It lasts a year or longer, it requires continuous medical care, and it limits daily activities. Chronic conditions often develop slowly over time. They are hard to treat and often cannot be cured. People with chronic conditions usually have a decrease in their physical, emotional, and social functionings because of the burden of the disease. The most common, costly, and preventable chronic conditions in the United States today include heart disease, cancer, stroke, diabetes, arthritis, overweight, and obesity. Heart disease, cancer, and stroke account for half of all deaths each year alone. Arthritis is the most common cause of disability in the United States. Over the past 3 decades, overweight and obesity have also become major health concerns. The number of adults and children who meet the definition for obesity has more than doubled in the United States. Other chronic conditions that have an impact on length and quality of life include behavioral health problems such as substance use and addiction disorders, mental illness such as depression or anxiety and dementia, cognitive impairment disorders, for example, attention deficits and hyperactivity, and developmental disabilities, such as Down syndrome and autism. Risk factors are conditions or circumstances that increase the chance that cancer might occur. These factors relate to lifestyle, environment, and heredity. There are many factors that contribute to whether or not a person develops a chronic condition. They include lifestyle and health risk behaviors. Are we physically active? Are we eating a healthy diet? Do we avoid smoking or exposure to secondhand smoke? Are we drinking too much alcohol? Healthcare access. Do we have access to appropriate, affordable, and culturally meaningful healthcare services? Physical environment. Do we live and work in a place that is safe, free of toxins, and promotes healthy lifestyles and choices? Social, cultural, and economic factors. Do we have a supportive family and community? How about access to culturally tailored and easy to understand health information? Do we have a stable income? In the United States, almost 2 out of 3 deaths due to cancer can be connected to preventable risk factors, especially by tobacco use alone. In addition, about 1 out of 3 deaths for any reasons was attributed to poor nutrition, physical inactivity, overweight, and obesity. These are also preventable risk factors for other chronic diseases, such as diabetes and heart disease. There are some types of cancers that are related to where we live and work, in other words, to our environment. Carcinogens, or substances capable of causing cancer, can be found in the air, water, and soil. Cancer is not considered to be inherited illness because most cancers, perhaps 80 to 90% of them, occur in people with no family history of cancer. However, if a family carries a certain cancer gene, the family members are more at risk of developing cancer. For example, for every 10 women with breast cancer, only 1 will have it because of inheritance of a breast cancer gene. It is important that you talk to your family about your cancer history and see your doctor to learn about your risk factors and what you should do. You could say that all cancers are genetic because cancer starts with genes that have been damaged. Still, even though all cancers are genetic, only 1 out of 10 cancers are inherited. Most cancers begin in cells that have been damaged because of exposure to radiation or chemicals. or bad eating, drinking, and smoking habits. If you know of someone going through gene testing, it just means that they're checking their DNA to know about their ancestry or to see if they have genes that are connected to a certain disease, in this case, cancer. Typically, the DNA is taken from blood samples. This testing can only tell you if cancer mutation is present, but this does not indicate that you will have cancer. In cancer studies, gene testing can be used to estimate cancer risks, diagnose some types of cancer, and predict a patient's reaction to a treatment. Family members share genes, behaviors, lifestyles, and environments that may influence their health and risk of chronic disease. If you have a blood relative, like parents or siblings, with a chronic condition, you may be at high risk of developing this disease. Diagnoses of a condition at an early age, rare diseases, or diseases common in a family should be also considered as possible health risks. Although some people believe that there is nothing to do to prevent cancer, the truth is that there are many things you could do to lower your risk of having cancer, such as the ones in this list. We encourage you to practice healthy habits and to teach them to your family members. We will cover these tips more in detail in the next slides. We have all heard it, right? Smoking is not good for you. Avoiding tobacco use is the most important step Americans can take to reduce the cancer burden in this country. Tobacco use remains the largest preventable cause of death in the United States. Tobacco use, including being around smokers, like secondhand smoking, increases the risk of cancer in the lungs and mouth, of course, but also other cancers such as stomach, colorectal, and liver cancer. Can you imagine yourself having a cancer through surgery and having to talk through a device in your neck instead of your mouth? That is what could happen if you are a smoker. Unfortunately, more than half of Americans are overweight or obese. Being obese puts you at a bigger risk for developing many cancers. As we see in the table, African Americans have a higher percentage of obesity than the other groups. The connection between body weight and cancer risk is believed to be related to effects on cell growth, along with other factors. Maintaining a healthy weight helps you not only to feel and look better, but also to reduce the chances of getting cancer. 1 in 3 people who died of cancer had a poor diet and were not physically active. How much do you move, and how well do you eat? Movement and exercise helps in many ways to reduce the risk of several types of cancer, including breast, colon, and prostate cancer. An active life can also lower the risk of heart disease, diabetes, and hypertension. For these reasons, it is important to move our bodies more and improve our lifestyles. Adults should exercise at least 30 minutes 5 days of the week. Children and adolescents should participate in active play at least 60 minutes a day, 5 days a week. So, let's move more today. After smoking, diet is the number 2 changeable risk factor. 1 in 4 cases of cancer can be related back to bad eating habits. It is important to eat healthy foods, limiting food with high calories and carbohydrates. Eat 5 to 9 servings of a variety of vegetables and fruits each day. Limit French fries, chips, and other fried vegetable products, and choose 100% juice if you drink fruit or vegetable juices. Choose whole grain rice, bread, pasta, and cereals, limiting consumption of pastries, sweetened cereals, and other high sugar foods. Limit consumption of processed and red meats. Choose fish, poultry, or beans. But when you do eat meats, select lean cuts and eat smaller portions. Controlling portion size will help to maintain a healthy weight. A drink is described as 12 ounces of regular beer, 5 ounces of wine, or 1.5 ounces of 80% proof liquor. Heavy alcohol leads to greater increases in risk for most of the alcohol-related cancers, such as mouth, esophagus, and liver. Research has also connected alcohol drinking as a cause of cancer of the breast and colorectal. The earlier you begin drinking alcohol on a daily basis, the greater the cancer risks. Also, using alcohol with tobacco is worse than using either one alone, because it increases the chances of getting cancers of the mouth, throat, and esophagus. Beautiful days on the beach, at the park, or even at the spa are sometimes just what you need, but it is important to know the risks. UV radiation comes from the sun, sun lamps, tanning beds, and tanning booths. Your risk of skin cancer is related to lifetime exposure to these items. Most skin cancer appears after the age of 50, but the sun affects everyone's skin at an earlier age. However, people who have fair skin, freckles, or burn easily are at a greater risk. People who live in the South, such as Louisiana, Texas, and Florida, have a higher risk of skin cancer. This is present even in cold weather or on a cloudy day. It is best to limit your time in the sun. Therefore, it is recommended not to spend too much time outside during the hours of 10 a.m. to 4 p.m. and to always protect yourself in the sun, using sunscreen with an SPF of at least 15. Vaccines might be a good way to prevent cancer risks for you. HPV is a sexually transmitted virus that can lead to cervical cancer. The shot that protects against the two cancer types of HPV is recommended for girls between the ages of 11 and 12. Without proper vaccinations, hepatitis B can also increase your risk of getting liver cancer. Immunizations are recommended for all babies in the United States. Certain high-risk adults may also need to be vaccinated. Talk to your doctor about whether you would benefit from immunizations to reduce your risk of cancer. As already mentioned, HPV is most often related with cervical cancer, but HPV may also increase the risks of cancer of the penis, throat, and vagina. The more sexual partners you have in your life, the more likely you are to have HPV. People with HIV or AIDS have an increased risk of anal, cervical, and liver cancers. People with multiple sexual partners and IV drug users who share needles have an increased risk of HIV and both forms of hepatitis. It is best to reduce your risks of these cancers by avoiding this type of behavior. Use protection during sex and limit the number of sexual partners you have. And do not share needles. Seek help for your addiction if you use drugs. Some types of cancers can be found before they cause symptoms. Checking for cancer in people who have no symptoms is called screening. Detecting cancers early improves the chances that treatment will be successful. This is very important, and it ultimately saves lives. By reaching the end of this module, you should have an understanding of cancer risk factors and how to reduce risks associated with cancer. We invite you to follow us into Module 4, where we will discuss cancer screenings and early detection of this disease.